Hello everybody and a very warm welcome to episode 4 of Stewarts Soundbites. The last 4 weeks have gone really fast, but I hope you've been enjoying this little series. Today we've got a great guest. We're really lucky. We've got Dr Donald Brechin. He is a neuropsychologist based at South Tees Hospital, and you've been working throughout the pandemic, Don, so it's really interesting to talk to you today. I should mention that Don's not only is actively working in the NHS as a treating clinician, he's also an expert, a neuropsychological expert, and assists in catastrophic injury cases. So it's really interesting, and thank you ever so much for being with us today, Don. It's really good to have you. Today we're going to talk a little bit about how people have coped, I suppose, with the pandemic from a psychological point of view. And I wanted to ask you, first of all, just to give us a little bit of context, because obviously you've been working throughout the pandemic at the hospital and as a consultant clinical neuropsychologist. And I was just wondering if you could just give us a little bit of insight really into what the hospital setting has been like and sort of how things changed at the outset back in March.
Hi, yeah, Emma, thank you for inviting me along. I don't think in my career I've seen anything on quite such a scale as we had back in sort of February, March. And in March, we had an official letter from NHS England to tell us what to do as a hospital. And we'd been under sort of what's called level 4 command and control. So it's very unusual for individual hospitals to be told directly from the centre what to do. And basically what the hospital had to do was create extra intensive care capacity, which meant freeing up a lot of beds in the hospital. Lots of people were redeployed from different wards, may have been going back into roles they hadn't done for a number of years, but the whole focus was very much about increasing capacity to be able to admit a large number of very poorly patients. And so lots of other services were scaled down, various essential services were kept in, cancer services and so forth, but for most of us it meant cancelling outpatient clinics, being redeployed to particular areas. And from a medical psychology point of view, basically we changed our focus from working with patients and carers to actually thinking about supporting staff, given the upcoming work that they were likely to be facing. So the sort of scale of what we're doing and the nature of what we're doing completely changed as a hospital.
I think that's really easily overlooked, isn't it, Don? Because obviously there's a huge focus on, I mean, everything. We've been living and breathing the pandemic for months, and everyone's been, I think, supportive of the NHS, but actually applying your mind as to how the staff working in that environment are affected, I think sometimes it's easy to kind of overlook that. So it's interesting to hear, you know, that your work at the hospital didn't only revolve around the patients that you're treating, but also had to apply to staff as well.
I mean, we know from the literature that anyone who works in an environment where they're sort of frontline and dealing with crises and so forth, although healthcare workers and emergency workers are reasonably resilient, we're all human beings. So if we're exposed to difficult situations, then, you know, quite naturally we will react, and there are predictable ways in which we'll react. And right from the outset, places like the World Health Organization and the NHSEI themselves, they recognised that frontline staff needed access to lots of physical resources. You know, wearing PPE is very physically stressful, but also emotional resources as well, because you know, it was going to be a tough period of time, and you know, lots of people dealing with uncertainty as well. I think, you know, that's then not unique to the NHS. It was for all of us. There's this period of uncertainty, period of threat. We didn't know what was going to happen, all these very scary messages going out about this threatening illness and potentially lots of deaths and so forth. And we kind of saw it early on as well. No one was immune. You know, obviously Boris Johnson ended up in intensive care for a period of time. So it was a very uncertain time, and you know, not just in the hospital, but for everyone.
Yeah, even, you know, working at home and adapting to being at home all the time is draining for everybody, and it's, as you say, it's frightening. I think you've hit the nail on the head, John, from a completely layperson point of view, it's the uncertainty of the situation that is so daunting. And it's interesting that you found how that's applied in all different aspects.
I think that uncertainty was probably the biggest single thing that we noticed. So as we were going around and wards were being directed to a new purpose and people were working in one specialty and then very suddenly were being asked to work in a different way, it was that uncertainty, that sense of what's this going to mean? Are we going to be safe as healthcare workers? Where's the PPE and so forth? And those situations, it activates our threat system. And there are various kind of automatic responses that go along with that. So our brain deals with threat in a different way. And it puts us on this kind of heightened state of alert, the kind of fight, flight, freeze response we all know about. And that kind of directs our attention to danger, and we can magnify danger and so forth. But coupled with that uncertainty, if we don't actually know what to do, that's an even more threatening state. So it's actually kind of quite normal in that situation to feel unsettled and to not be reacting in the normal ways. And actually, that was one of the key messages we were getting out there. That's actually, it's okay to not feel okay. That's a normal reaction to a very unusual circumstance. And it wasn't just that it was happening for us at work, it's happening at home as well. So people at work thinking, okay, I've got this stuff to do. And also, at home, what's going to happen with the kids? I've got an elderly relative and so forth. So actually, one of the messages we're trying to get out is, okay, look, given all that's going on, you're not superhuman. It's okay to feel a bit unsettled. But then, of course, it's about, right, well, what do we do about that?
Yeah. And the hospital must have had to, you all must have had to adapt and act very swiftly and been pretty adaptable, because things have changed at a phenomenal pace and are still changing all the time. And as you say, that brings with it a sort of fresh uncertainty at each stage, which is hugely daunting. And we're talking generally, of course, at the minute about everybody, as well as frontline workers. But I think it is especially difficult for people who've been working on the front line, because I'm sure that lots of people will agree with me, but there's kind of, I think NHS staff are relied upon heavily and seen as kind of a comfort to people who are not working in that environment and don't have the same sense of responsibility. They're kind of a comfort blanket to everybody else, and that brings with it in and of itself a huge amount of pressure and responsibility.
I think NHS workers generally are very, very appreciative of the focus, but I think we're also quite glad that the notion of key worker was out there as well, because actually we
absolutely.
needed food. So I think that really, really helped. But that recognition, lots of people, society relies on all sorts of different functions. The NHS is just one bit of it. But in that period, I think we're all kind of craving information and knowing what to do next. And, we have daily briefings from the government at 5 o'clock and lots of information coming out. And so lots of what we're trying to do is just, I guess, help that system think about, okay, well, what do we need? We need regular communication. We need in bite-sized chunks that we can understand. We need clarity about how to proceed. And things like that, really. So stuff that was generally applicable, but particularly in the hospital setting, there's a lot of that thinking going on about how do we get information through, how do we provide clarity, do we have adequate rest areas, what information do people need, and things like that. And that applies more generally, obviously.
Of course, yeah. And I think the point you raised is an interesting one, this kind of expansion of the term key worker, and it has kind of awakened everybody to appreciate other services that have been so crucial and still are so crucial for us.
I remember sort of driving to work and then almost no cars on the road. I pulled into a filling station to fill up, and the worker behind the counter was very unsettled because they were having to come into work and they didn't have all the protections that we had in the NHS. So it was a very difficult time across the board. But I think we saw this in clients as well. What do I do now? And how am I going to sort of carry on with normal life?
Yeah, well, this is the interesting thing, isn't it? Because we've been talking generally about everybody really and how the pandemic's affected them. But you work, obviously, the nature of your work is that you work with people affected by brain injury of varying degrees. And how have you found that people who've sustained brain injuries, how do you find that they've coped from a psychological perspective during this time?
Yeah, I think that's been very interesting, because I think it's been just the same as the rest of us, but maybe magnified sometimes. So for some people, it's been an intense relief, and for some people, it's completely cut them off from what they need in the world. So I think for people with brain injury who perhaps can find things a bit overstimulating, a bit overwhelming, actually things being a bit calmer and being at home and knowing they haven't got to go out, they haven't got to go to rehab, or that's actually been quite reassuring. It's taken some pressure away from them. But there are other clients where actually they really, really rely on a structure and being able to get out, being able to meet with people, engaging in rehab or voluntary activities or part-time work, for whom that's really, really crucial, just as it is for all of us. And that's been a real struggle. But again, you know, you can apply this to all of us. It's not just people with brain injury, but I think for some people that has sort of made that much more difficult.
Yeah, and I suppose technology is another thing, isn't it? Because we use Zoom. I mean, I use Zoom every day, and it's not so straightforward for everybody. And you know, I'm involved with the Headway and Brain Injury Charity, and we've got some. I find that some of our members have actually adapted surprisingly well and coped with having sort of a new set of rules, which initially anyway were much more straightforward than they are now, and having that sort of rigidity was kind of helpful. But I think as the situation has evolved and the rules are confusing and the guidance is changing and progressing and going back, and you know, all the different stages, I'm sure that has been a problem in and of itself, kind of that state of constant flux. Have you found that, Don? That's been...
Yeah, definitely. And I think, you know, one thing we sort of try and, I guess, remind ourselves as well as communicate to others is that, you know, our circle of concern and our circle of influence are two related things, but are slightly separate. So I may be concerned about the wider world, but the things I can influence are much smaller. So I may worry about the global pandemic, but actually the things I can change are quite circumscribed. So, but sometimes times of uncertainty, our mind can go out to those bigger things that we can't change. And so some of the conversations we've had have been, okay, you know, recognize that, but what are the things within our gift that we can do? And also what's important to us as individuals. So, you know, maybe we can't go out and support our vulnerable relative or so forth, but given that's still important to us, how can we do that, but do it differently? And it may be, it's not practical support. It may be, you know, a supermarket's doing the delivery of food, but it may be that kind of connection via sort of technology like this, or just that sort of staying connected, and I guess giving people a sense that things, you know, will move on and so forth. So yeah, it's trying to have a focus, you know, because obviously the nature of what we can do has changed.
Yeah, of course. And I suppose that brings me kind of nicely on to the last thing that I wanted to ask you. I'm just conscious of the time. I don't want to keep you. And these are 15 minutes, which goes so fast. And I could talk to you all day, John, so I'm kind of resentful, but I'm just going to ask you, the last question that I wanted to ask you was, in terms of people who are coping, still struggling with how everything is at the minute and sort of everything changing, and those people with brain injury and the people caring for them as well, you know, have you got any kind of top tips for helping them cope?
Yeah, I think first of all, just to recognise it's not over. We've got further periods of uncertainty. This is not a one-off event. So I think just to recognise, you know, we mustn't be tough on ourselves. It's okay to still not feel okay, and that will come and go. I think going back to something I was saying earlier, it's about sort of trying to, I guess, hold on to the things that are important to us. So is it about connecting with other people? Is it about achieving certain things? Is it about supporting someone else? Whatever that is, it's about just trying to reconnect with those things and remind ourselves, and then think, right, well, how can we continue to do those things, be it with, you know, in different ways, telephone technology. Obviously there are, you know, restrictions, as we're speaking, restrictions have come in today on meeting. Yeah. How can we do that flexibly and differently? But I think if we're sort of finding ourselves stopping ourselves from doing stuff or stopping engaging, I think it's just trying to sort of take a pause and name that and saying, okay, you know, I'm feeling a bit stuck here. And even just saying that out loud is really, really important. And then having a conversation with someone else about that. And even if you're feeling angry or frustrated or anxious or whatever it is, I think just naming it and having a conversation with someone is the first step to thinking, okay, well, what's going on here? So yeah, we all vary. We've had it ourselves. I've certainly felt it, and it's taking that pause to think, okay, what am I feeling at this point, and having a conversation with someone.
I think that's a really powerful thing to remember, actually, Don. It's so widely applicable. Naming something and saying something out loud. Because I think in a lot of us, it's kind of inbuilt you've got this mindset you just kind of got to power on. And I think it's hugely helpful to hear that. So thank you very, very much, Don. It's been great to speak with you. I'm sorry we don't have longer, but I really appreciate it. I was going to make some announcements, but actually we've got a little bit of a break in this series over the next couple of weeks. So anything I was going to announce will probably have passed by the time that this is released. So that's one less thing for me to do and one less thing for you all to listen to. So thank you very much again for tuning in, and thank you, Dr. Brechin, for such an interesting conversation. Maybe we'll twist your arm to come back at some stage and we'll pick your brains even more. But thank you, and thanks for tuning in, everyone. Take care, stay safe. Bye-bye.
Bye-bye.